Today we'll be discussing actor Jamie Foxx and brain hemorrhages. This is Doctor versus Comedian. I'm Dr. Asif Doja, and this is the Doctor of Laughs.
Not a real doctor.
Ali Hassan. Every episode I pick a topic for Ali from comedy and entertainment, and I question him about it. Then Ali picks a topic for medicine and health and grills me on that topic. Now today we'll be discussing actor Jamie Foxx, his career, and his recent recovery from a brain hemorrhage and stroke. Then in our second half we're going to do a deep dive into brain bleeds. Does that sound like an okay plan to you, Ali?
Yeah. Are you waiting for me to protest, or what are you hoping to get out of me right now?
Just a modest agreement.
I modestly agree.
Okay, Ali, let's get started right away with this. There's a lot of stuff to talk about. The reason why this topic came up is because it's been in the news lately. Jamie Foxx, in the past month or so, released a special on Netflix. It's called What Happened Was. And it's him on stage in a theater in Atlanta talking about what happened to him in 2023. And he basically, as I mentioned, had this brain hemorrhage and stroke. So we'll talk about the details of that in a second. In fact, just by talking about the special, we're going to have to talk about what happened to him medically, because that's a lot of what the special is about. But before we do that, let's just you and I chat a little bit about Jamie Foxx, okay? So I got a bit of interesting tidbits for you about him, Ali. And then I want to talk to you about when you first saw him and everything. So his real name, Eric Marlon Bishop, okay? And I'm going to
Government name.
And in fact, he was born in Terrell, Texas, and he talks about that a lot in his special. And he was, shortly after birth, I guess his parents gave him up to his grandparents, and that's who raised him. So his parents weren't really part of his life, and he really credits, his grandparents and really his grandmother with creating the person who's now Jamie Foxx. And he was very involved in his church. And again, we're going to that's a little foreshadowing for his special. And he started playing piano at age 5. So he was like playing piano, singing, a lot of stuff for the church. Then became a basketball player, football player. He's a quarterback. And of course, that also foreshadows a certain movie he did later. He was the first player in his school's history to pass for more than 1,000 yards. So if I knew anything about football, I'm sure I'd find that impressive.
Yeah.
And then, he decided to get into the performing arts, and he tried out an open mic night in 1989 on a Girlfriend's Dare. And that's kind of when he started stand-up. So I actually forgot, Ali, that he was a stand-up comedian. Because, we'll talk about it in a second, but where did you get introduced to him? Because for me, I didn't know about him being a stand-up.
Well, I don't know if I knew he was a stand-up out of the gate, but I knew he was a comedic performer because I saw him on In Living Color, this fantastic black sketch show. Black except for
Jim Carrey. I loved In Living Color.
Our very own dude. That is a commentary in and of itself, on paper certainly, and then in practice as well, how undeniably funny Jim Carrey was. For him to, infiltrate, that sounds too strong. For him to be part of that sketch troupe. And of course, every black sketch troupe, every brown sketch troupe, you benefit from having a white person just for the sort of the variety of characters. But Jim Carrey was truly something to behold. But that said, as one of, there was a few guys who were like these sort of secondary characters who wouldn't be in the bulk of the sketches, but when they came on, they owned it. And they've gone on to be, pretty significant comedians, a number of them. And Jamie Foxx was definitely one. I remember LaQuanda?
Wanda, yeah.
It was maybe Wanda.
And that was probably his classic character. I forgot about it, then I rewatched it. I'm like, oh my gosh, I totally remember this person. And we should probably talk about In Living Color at some point. 4 or 5 seasons, I think. But like Kean Ivory Wayans, Damon Wayans, David Alan Grier, Tommy Davidson, Kim Wayans, like really, man, that was a great show. Again, would stand the test of time now. I mean, some of the jokes maybe haven't aged that well, but I thought it was hilarious. So that's when I saw him too. So I didn't know he was a stand-up, but I have a quiz for you about Jamie Foxx's stand-up comedy.
Oh, yes, please.
Do you know why he chose the name Jamie Foxx?
I do, actually.
Oh, did you? Maybe you told me this story. I'm not sure why, but let's tell our listeners.
He went for a name that, in the end, it could be a man or a woman. That serves him. But what he was really going for was a female name, because you would get booked on shows a little bit more wherever he was if you were a female. So he was getting, his goal was to get on as many shows as possible. So Eric, there's no mistaking. Jamie, there's a doubt. So yeah, pretty smart. And then the Fox is a tribute to Red Fox, who we should actually also talk about in depth. We have on this podcast when we talk about comedians and dirty comedy and, various legends who've come through who haven't got their due. But I think an episode could be devoted to Red Fox.
Yeah, for sure. Okay, let's write that down. Tell our assistant to write that down. Google
Johnny?
Assistant? So that's when I saw him too. And I, thought of him as a comedic sketch actor, right? And then I remember when he was cast in Any Given Sunday. So this is Oliver Stone's football movie. Have you seen, I'm assuming you have seen Any Given Sunday.
I have. It was quite good, actually. I really enjoyed it. I remember enjoying it.
Great movie. Me and my friends loved that movie when it came out. So much fun. Al Pacino, obviously, playing, I think, the coach in that movie.
I don't think we'd ever seen LL Cool J acting before outside of his music videos, right?
And apparently him and Jamie Foxx hated each other and got into fistfights.
Yeah, I think LL was trying to give him the gears. No, that's not the right thing. But I think he was trying to haze him a little bit. Like, hey, man, you're not really part of the fraternity here, but we're just trying to pull some pranks on you and this kind of stuff. And Jamie Foxx wasn't having it at all. And he was giving it back as good as he got it, and he wasn't taking it in the spirit it was being offered. He didn't want to be. It's basically bullying, and he wouldn't allow himself to be bullying. And yeah, that's what I remember. I don't remember all the details, but yeah, they did not like each other is a fact.
So it's funny that you think about how he, being Jamie Foxx, was a football player, and then obviously plays a football player in Any Given Sunday. I thought it was a stretch, but it really wasn't for him.
Yeah.
And then speaking of stretching himself, then he did more dramatic roles, right? 2001, he starred opposite Will Smith in the Ali, the biography of Muhammad Ali.
I believe it's pronounced Ali.
Ali, yes, that's a good point. You see, because it's his name everywhere.
Muhammad Ali, right?
Then he was in 2004, this was his biggest year of his career, he was Ray Charles in the movie Ray. Then he won the Academy Award for Best Actor and the BAFTA that year as well. And he also that year was the third male in history to have 2 acting nominations in the same year, because the other movie he was in was Collateral. Have you seen Collateral with?
I have seen Collateral. I really liked it. I didn't think it was Oscar nom worthy, but I did think he did a great job. Yeah.
Really? So you preferred Ray out of those 2 performances?
Well, Ray is fantastic. I mean, Ray is a guy doing so much studying of this person when you've got to, same as Will Smith, but I'm loath to sort of compliment Will Smith, but how much you have to study somebody's own history and their movements and their inflection and their world to do justice to these revered characters. There's a lot of pressure on you to play a role like that properly. I feel Collateral didn't have that, obviously. It was good. Maybe I got distracted by Tom Cruise. I
thought Tom Cruise was really good in that too, playing a villain, not the type of thing that Tom Cruise usually does. So he was branching out as well. Yeah, I don't know. I probably have to rewatch Collateral to see about that.
By the way, Jamie Foxx, the third male in history to receive 2 acting Oscar nominations in the same year for different movies. The other 2 are Al Pacino and Barry Fitzgerald. Who is Barry Fitzgerald?
I don't know.
Oh, okay. All right. I thought as a movie buff, you would know who that is. I'm like, who is this double nom in a year guy that I've never heard of?
Oh, he was active in the 40s, Bringing Up Baby, How Green Was My Valley.
Ah, the old 40s.
We're a bit ignorant
now I understand.
That was me Googling that very quickly. Okay, so continuing on with Jamie Foxx's career, then, of course, one of my favorite performances, Django Unchained, in 2012 with Kerry Washington, Christoph Waltz, DiCaprio, of course, Samuel L. Jackson. Just really great performances in that movie. Then he did a couple things my kids are more familiar with. He was in Amazing Spider-Man 2 as Electro, and he recently reprised that role in the last Spider-Man movie. And he was in Annie, the remake of Annie. My kids have seen both Annies, the one from the 70s, early 80s, and this one with Quinvazane. How do you say her name? Quinvazane Wallace.
Quevinzane?
They like this one too, they like this one too.
The kids do, yeah. I didn't pick up on, of course I've seen The Amazing Spider-Man 2, but didn't really pick up on Jamie Foxx's performance in that. Like he didn't really.
It was a bit much. Like he plays like a nerd who's like a nerd / janitor in this high-tech place, Oscorp, and then he gets, I think, electrocuted by electric eels and becomes Electro. So yeah, that was a bit of, his acting was not ideal in that.
I found Annie, the character Annie, tomorrow. I was like, shit. So I just couldn't watch any version of Annie.
Oh my gosh,
unfortunately.
my family loves Annie so much. They're gonna hit you for
that.
Okay, so but this transitions into his music career, right? So he obviously was doing music again. He is like plays piano, sings, and so Annie was kind of made sense for him, right? Because he played the Daddy Warbucks. His name wasn't Daddy Warbucks in that remake. It was like Daddy Big Bucks or something like that. I forget what it was. Daddy Benjamins or something. But so it made sense for him to be doing some singing. But I really don't know a lot of his music. I know Gold Digger with Kanye West. That's about it. Do you know a lot of his songs?
No, I don't know much of his music at all. I know that he sang in his special. He sings a song that I did recognize. And obviously he did, Ray Charles and this kind of stuff. He's incredible mimic.
That's one interesting thing. Like, yeah, he's a great singer, but he is an amazing impressionist. And that's one of the reasons why Ray Charles, his performance of Ray Charles was so good. It wasn't just mimicking him. I'm not trying to shortchange that performance, but yeah, he's amazing. In his special, he does, like, who else? Mike Tyson. His Denzel is excellent. He does Dave Chappelle. It's quite good stuff. So,
well, hold on a second. You have left out in this little bio you've left out two incredible things that Jamie Foxx has done. Number one, the Jamie Foxx Show. Did you not ever see the Jamie Foxx Show?
I never watched it.
Okay. Well, I was a pretty miserable IT consultant in Chicago, hated every single thing about my daylight hours life, but I'd come home after just being like, well, this can't be my life. This can't be who I am. How did I get into this? And I'd watch some back-to-back episodes of the Jamie Foxx Show. Jamie Foxx, Garcelle Beauvais. Garcelle Beauvais was obscenely attractive, played a woman named Fancy. They were like employees at the inn. I think he was an employee. She was like more of a manager at the inn. Somebody else owned the inn. It was like a Black Faulty Towers almost. Well, not exactly, but in that same space as far as location and hijinks. The Jamie Foxx Show, I don't believe it gets enough due. I thought it was a very good sitcom. I think it gets overlooked quite a bit. And, it was the Jamie Foxx Show. So you got to know his singing voice. You got to know his comedic, timing and his comedic beats. And it was a great introduction to this guy. And I only put it together later that's Wanda, for God's sake. I can't believe that's the same dude. And then you're also leaving out another thing that he did on a roast. Does that mean anything to you, Asif?
No.
Okay, well, the year, I believe, was 2010, or it was maybe before that, because this particular comedian has spoken about it since. But this guy was doing it was the roast of Shaq, and this guy, Doug something, poor guy, like this is kind of where we're at.
I believe.
Doug Williams, who not too many people know. Not a lot has been said.
I looked it up, and there's a link that says the time Jamie Foxx ended Doug Williams' career.
Yeah. I mean, Doug Williams was struggling as a roaster. He was struggling, and Jamie I used to watch this once a year. It was kind of like a cautionary tale, like never be in a situation like this. He started doing the voice of God, and he was just like, "Hi, Doug, it's me, God. I think it's time to wrap up now." And then he's like, you keep trying to make jokes, but they're really not working. And he was just doing this like God's voice. And, Doug would be like, okay, Jamie. And he'd be like, no, this is not Jamie. This is God. And his impersonation of a God who was basically roasting Doug Williams was 100 times funnier than anything Doug Williams had to say. And it was, it's a roast. So it's a merciless situation to begin with. It came out later. This, is more hearsay, but it's like Jamie was trying to like help some people in the back, backstage, like punch up their jokes or whatever. And I don't even know if I want to believe this or need to believe this, but Doug Williams was like, I'm good, man. I don't need any help. And Jamie was like, all right. So when he saw that Doug was like floundering in this roast, he was like, all right, I'm going in. But he got him really good. And it's like, it's to be watched, but you have to watch it in the spirit of a roast. Otherwise you will be like, I hate everything about Jamie Foxx. But I mean, from my perspective, it's like, don't do something you're not ready to do. Who are you that you would be on the roast of Shaquille O'Neal anyway? You got to be ready for that. I mean, that is the big stage. And, I don't remember like terrible jokes about like Shaq got a sports car. He can't fit in a sports car. That sports car is as big as his foot. That's like his big punchline. I don't remember, it's all vague memories now, but I should watch it again. I honestly used to watch this once a year, but that is part of Jamie Foxx's legacy. I mean, that really put anyone who didn't know Jamie Foxx knew about him after that day. And anyone who did know Doug Williams wished he didn't know Doug Williams after that day. It was a very interesting thing that happened.
So can we talk about his special now or?
Fine. Yes, we can.
There will be spoilers. There's no way we can talk about this without spoilers because we have to talk about the content of the special.
Can do.
Sorry about that. And so if you don't want to listen to this part, then just fast forward to the next health section. So the special, like we said, it takes place in Atlanta. That's the setting where the theater is. The audience is, the vast majority is black. I don't recall seeing a white person in the audience. There may have been.
Oh, no, I saw a handful. Sure.
Yeah.
I didn't see any brown guys, but I saw some white women.
Okay. Yeah. And then so it's him, and he starts off. It's a very interesting special. I've never seen anything like this, first of all.
Yeah. To paint a picture for people, the discussions, if you're not going to watch it, the discussions that are happening right now are, is this a comedy special? So when you say, I've never seen a comedy special like this, many people have gone further than that and said, I don't believe this is a comedy special. And so there's sort of a debate going back and forth on this very subject. But yeah, tell me how you felt about this. So you've never seen anything like it?
Right. So it's him talking about the story of what happened to him with his stroke. That's part of what's going on. And so the short story is he developed a severe headache one day, asking his family, could I get like an aspirin or something? They didn't know what was going on. They took him to a doctor, gave him like a corticosteroid shot, which is very unusual to give someone for a headache. But anyway, and then his sister thought this was garbage. They drove around and they just went to this hospital in Atlanta and they admitted him. And then he said he didn't remember anything for 20 days, basically. He had lack of memory for 20 days. And when he woke up, they told him, you had a brain bleed. I'll shorten the story, but you had a brain bleed and a stroke. And in our second section, we'll talk about, how those are related or different. And he couldn't walk. And he basically was transferred to a rehab facility in Chicago and had to relearn these functions. He had a tremor in his head. He had dizziness all the time. And he had to work to getting back to being a functioning human being. And that's the story he tells, interspersing that with stories about the doctors and therapists and nurses, especially, that he worked with and got him motivated. Talks about that. He talks about how his family reacted to it, his sister, his daughters. And yeah, I guess is that a good summary, at least of the health aspects?
It's called, I'm not sure if you gave the title, it's called What Had Happened Was, yeah, and the whole thing was to explain what happened, because the backstory also, Asif, that I think is needed is that nobody knew what was happening publicly to Jamie Foxx. Privately, we found out also that they didn't really know, at least they didn't know the why of it. Yeah. It was very tightly wrapped, and that led to a lot of conspiracy theories, a lot of people believing that Jamie Foxx had been cloned, because when they saw him, they're like, that's not really him, that's a clone. I know Jamie Foxx, that's not what, of course, internet went pretty wild with that. And I think a lot of the stuff he does on stage is almost like a tongue-in-cheek sort of like, could a clone do this? Could a clone move like this? I'm obviously not a clone, and look at my,
Yeah.
But yeah, I think so the background was nobody really knew what happened. So this is the show that like Jamie bears all, and
He's never spoken about this before. This is the only time you will, because if you try to look for articles about what happened, the only way you can find it is articles summarizing this comedy special. So it was very similar to Chris Rock not talking about the Will Smith slap until he released his Netflix comedy special.
Yeah, I feel differently about these two specials. I feel like what happened to Jamie is such a serious thing. I would have loved this to have been he sits on a stool in an intimate club and tells the story, and that's filmed, and I think that would have been interesting. The way this is so heavily produced, like he's in tears and he goes, and then I said this, and then the DJ hits something and the lights come out and there's like the monitor, the heart monitor on the back on the screen. It's so heavily produced that it's just, I couldn't stop thinking about like the capitalistic version of like, okay, how do we make some money off my illness here? How do we capitalize financially on this? I couldn't get that out of my mind. Whereas Chris Rock is a comedian. He does release specials. Probably had a special coming out. The plan was like in 2 years, let's fast forward. It's going to come out in 8 months because now we've had this slap and now that sets up the thing for, I did not feel it like it was as opportunistic and financially motivated.
I thought you were going to say the opposite, but.
No, because it's been 21 years since Jamie Foxx had a comedy special, man. Yeah, he's comedy. He's well-versed as a comedian and all that. Okay. But this wasn't a plan. He did this specifically. And maybe he doesn't look at it that way. He's like, look, I want to tell my fans what happened, but I want to do it my way. What's my way? Oh, my way is comedy. But it's fine. That is what it is. America, right? America. That's how they're going to do it in America. You're going to make some money off whatever you can. That's the whole hustle. More than that, in the venue itself, it felt like you're in a black church. You felt like you were in a place of healing and community. And, that's not my background. Attending black church is not something I've done or do. Would love to, but that's not what I associate with comedy. So that's where you get into some tricky waters for people.
Okay, a lot of stuff to talk about here. A lot of stuff to unpack.
A lot to unpack.
Okay, what you said. Okay, so let's start at the beginning of what you said. So yeah, that's fine. I understand the opportunistic, point of view. He does cry a lot during it, and I did too, probably like 8 times. So it's very emotional. And so I'm just going to ask you point blank. Do you think he's a good actor too? Do you think he was putting on those tears, or do you think they were genuine?
No, if he put on the tears, I think it was just, he might have given a little extra to it, but I can't imagine he wasn't emotional beyond belief because he did almost lose his life. He did have to start fresh. He was back in Atlanta, close to the Piedmont Hospital where, he was sort of saved, and he'd be saying Atlanta saved. I think it's very emotional. It's a very emotional situation. I think he's incredibly grateful to God. I think he's grateful to the city. I think he's grateful to his fans. So no. The short answer is I don't believe those were manufactured tears. I think it was an emotional situation.
That was my first question. The second one is this issue of this is a comedy special, which, I think we'll probably keep talking about that even after we're off recording. So the question is this a funny special?
I laughed a couple of times, there was funny. And now here's the other thing, he starts very slowly because of the emotions. And he starts very slowly because it's just this back and forth. It's black church vibes early out of the gate, And a lot of people, if you go on Reddit, people will be like, I said to my wife, if he says Atlanta saved me one more time, I'm out. And he said it and I was out. And that's like minute 8, right? People were already like, we get it, man. Atlanta saved you. Where's the comedy, right? I didn't have that outlook. I wasn't like, get to the comedy. I was like, I'm here for this journey. I'm a fan of Jamie Foxx's. I've been a fan since mid-90s. I like this man. I'm going to go on this journey with him. So I wasn't like, don't say this again or I'm out and this is not comedy. I think certain people were holding him to a certain standard, which is fair when you say Jamie Foxx's stand-up comedy special, right? So the question becomes then, or maybe not do, but what responsibility do comedians have to tell their fans, like, this is what kind of special this is going to be?
Right. And I think he has a benefit because, as you said, he hasn't done a comedy special in years, if ever. I'm sure he has some, but, you know,
No, he has 3 specials, and then he hosted a series for
he's not known for this as much as he is known for his other stuff, especially lately. So I think that's fair. But I wouldn't label this a comedy special. I would label this a special and go from there. Because then it gets into the third thing I was going to mention about what you had said, which is this idea of the religiousness. And it does feel like a church. And the people are talking to him as you would be responding to a preacher at the front on the dais of a church. And again, I don't necessarily find there's anything wrong with that. It's just, like I said, something I've never seen before. And you also have to put in perspective of Jamie Foxx. He was raised in a very religious household, went to church all the time, and he himself says he's kind of fallen away from God over time. And then this thing happens to him, you know, and of course, you know, he says something which is a true statement, but which a lot of us don't think about. We all think about the future and we think about, you know, success and fame and good things happen to us. But you don't think, like, he never in a million years thought this would happen to him. And he says many times to his friends when he's trying to deal with this at the beginning, like, I'm Jamie Foxx. This does not happen to me.
Okay, so 2 things that I can't believe that you have not brought up out of the gate. I'm shocked. Knowing you as long as I've known you, I can't believe you did not bring up the narcissism that is on full display connected to the I'm Jamie Foxx. This doesn't happen to me. Okay, there's a medical angle there too that, like, why wouldn't this happen to you? And then saying, I'm Jamie Foxx, I brought you this. And then on the screen, little, you know, so you go through his highlight reel. So that's just like basically like he's rubbing himself in oil and touching his nipples type of vibe, basically, right? So there's A. And B, I'm imagining the reaction of somebody who works for the Heart and Stroke Foundation. And they're like, wow, you are setting stroke awareness back many, many decades by being like, I got a stroke, and this is a major spoiler, I got a stroke because God gave me a stroke, and God gave me a stroke because I severed my ties with the church, right? Okay. So I can't believe those 2 things did not come up for you immediately. Like, I don't even know you anymore.
No, hold on. Okay, so there's a couple of things. So the narcissism for sure, but listen, Ali, like, trust me, I, you know, see a lot of patients because that's what I do for my job. Nobody thinks anything's going to happen to them. And everyone thinks that they're exceptional or their children are. Everyone thinks that. That's the way people think. So I don't, you know, whatever. I mean, he's rich, he's famous, he's a established actor, singer. What he does think he's above that, but everybody thinks that. No one ever thinks. Okay. I think I've told you this quote before.
Interesting.
No one thinks their kid is going to be average or have a learning disability. They think their kid's going to become the prime minister of Canada.
Sure. Yeah, I got a kid in hockey. You know? I got a kid in hockey. I've seen it every single day.
Right.
Yeah.
So that I don't feel that bad about. But the idea that what you're getting at is that this special is somewhat self-indulgent. Yes. And he does that, you know, when he's talking about his journeys, like, you know, what I would do is I would put on a different character every time the nurses came. So that allows him to do his Denzel impression, Dave Chappelle impression, Mike Tyson impression, whatever.
Yeah.
That didn't happen.
If I can stay funny, I can stay alive, I think was his line, right?
So I don't think that really happened. I'm sure he did his impressions because, like, he's a funny guy and he's stuck in a rehab hospital for months and months, so probably he did, but I'm not sure it happened. But that's fine. That's some artistic license. I do think it's like, you know, as you're saying, at the end of the special, he's trying to prove he's not a clone. He's like, could Jamie Foxx have given you this? And he plays his highlights. He shows Any Given Sunday. He shows Grey. He does all these things. And I'm like, yeah, that's relatively self-indulgent, but if his overall point is to say, I am back, you know, that's why he does the dancing. That's why he does the singing, why he plays piano. Like, you know, again, I'm not his doctor, but I am a neurologist. I could not see any issues with anything about him. You know, he seems fine. And that's probably okay. And in terms of the awareness, I mean, again, you know, I see a lot of religious people as well. Like, oh, we're just going to trust in God. Or, you know, if this is God's will, this is the way it is. That's fine as well. 2 things can be true. God can have caused this, and God also created hypertension, diabetes, and all the other things we're going to talk about in our second time. That's fine as well. And to be fair with Jamie Foxx, he didn't, like, well, actually, I guess I'm more agreeing with you that we don't know if he has high blood pressure. We don't know if he has risks for having this kind of hemorrhagic stroke. And so him not saying that, he just said they couldn't find a cause. Okay. That obviously happens a lot, as you know, people who listen to this podcast, right? Anyway, so I think those are the kind of how I would respond to those things. So I'm not terribly upset by it. I just thought it was, I guess I kind of understand and empathize a bit with him just from his situation. I don't know. Does that make sense?
Interesting. Yeah. Okay. Yeah. I empathize with you for empathizing with him.
There we go.
You know what I mean?
A lot of empathy here, guys. So I don't know, the question is, would I recommend people watch this? Oh, the other thing I got to mention is, he mentions God, his praise of God, his thankfulness to God for getting him through this a million times. But I've never in my life seen God mentioned so many times and so many N-word, mentions. He says the N-word so many times in this. So then I'm like, because we could be telling you about this, you'd be like, oh, this sounds like an inspirational story. And it is. It's amazing how he's recovered. It's when I tell you about the prognosis of hemorrhagic stroke in a few minutes, it's amazing what happened to him. Is it miraculous? Sure. I'll use the word miraculous. I don't have a problem saying that. But he just uses the N-word all the time. I'm like, who can I recommend this to?
Yeah.
It's very unusual. So that's why I tell you when I said I've never seen something like this before. I don't know.
My recommendation is yes, but for people who know and love Jamie Foxx. I think that's important. I think Reddit is mostly people who are like casual fans, and they were out because it didn't get to the funny quickly enough. They were out because it was so, the self sort of masturbatory thing about like, this is who I am, this is what I do. And just like, just like I'm the king of everything I do sort of vibe. People were out over that. But I think if you really like Jamie Foxx, and I think he's an insanely talented human being, I think there's something there to take out of it. And if you're religious, great. If you're not, it's not the end of the world. I'm not. But if you're anti-religious, you also might be like, this is church. This is not a stand-up comedy special. So keep that all in mind. If you know Jamie Foxx and you like him and you know his work and you know who he is, I think you would like this special. Everybody else, keep it moving. Okay, so this is always something that I enjoy when the celebrity or the entertainment topic and the medical topic merge, and that's definitely the case. And it's so much the case, in fact, Jamie Foxx, his special dealing with this very thing. So let's break it down. Hemorrhagic stroke, and I'll spoil it for everyone. Jamie Foxx said it right out of the gate. We still don't know why it happened. So if you can illuminate that in any way, that would be awesome, Asif. But let's talk about what a hemorrhagic?
Yeah, stroke. Yeah, you got
hemorrhagic?
It. No, you said it, but that's the first time. Stick with that.
Hemorrhagic stroke is.
Right. So let's start off with, strokes in general. So stroke, also called a cerebrovascular accident. Very common, third major cause of morbidity and mortality in many countries. And a stroke can either be ischemic or hemorrhagic. So when it's ischemic, that's when you have a blockage of a blood vessel, just like a heart attack is a blockage of a blood vessel in your heart.
That's more common?
That is more common. Exactly. And so a minority of strokes, then what we call hemorrhagic. So that's a blood vessel bursting, essentially.
Blockage versus bursting.
So that's when we say, so he had a brain hemorrhage and a hemorrhagic stroke. But because a stroke is basically a lack of blood flow to an area of the brain, right? So that could be caused by a blockage, or if the blood vessel ruptures, then obviously there's no blood flow going to that because, the garden hose has been ruptured, right?
Now, Asif, I've seen my fair share of medical TV. I've been in some medical TV, and sometimes you'll hear this, he's hemorrhaging.
Hemorrhaging, yes.
And hemorrhaging is another way of saying bleeding.
Correct.
Is that right?
Exactly.
In a place where there should not be any bleeding?
Yeah, exactly. And so when you have a brain bleed, you can have an intracerebral hemorrhage, which is in the brain substance itself, or you can have a subarachnoid hemorrhage, which is basically around the coating of the brain. When people have a ruptured aneurysm, that's usually a subarachnoid hemorrhage. But let's not talk about those for today.
Sure. And also, here's a very intelligent question for you. Why do a hemorrhage and hemorrhoid start with the same first 7 letters? Are those related?
Because it relates to blood. And so
Hemorrhoids are
they're
bloody?
engorged
They
blood
can be
vessels. Engorged blood
Oh my God.
vessels. Yeah.
Okay. Oh, like hemoglobin, the hem,
Yeah.
that's the hem. It's
Yeah.
blood, of
Exactly.
course. Yeah. I didn't recognize it in its form there.
Yeah.
Okay. All right.
There we go.
I'm all caught up. What causes a hemorrhagic stroke?
Okay, so we do know what often causes
What?
it. And we're going to talk mainly about adults. At the end of this little section, I can talk to you about what happens in kids, because we do see this in kids as well, but different causes. So the number one cause in adults is high blood pressure, which is one of the reasons why people try and control high blood pressure so much. So the high blood pressure, the short story is it weakens the blood vessel lining, and then eventually it could burst. That's the very short story about that. So high blood pressure for sure. That's again why we get so concerned about it. And you can check our archives for an old episode about high blood pressure. The other thing that adults can get is something called cerebral amyloid angiopathy, which is a deposition of this substance amyloid in your blood vessels. Okay. And it occurs mainly in adults. I've never really heard of it occurring in kids. And why people get this deposition, sometimes it's genetic factors, sometimes it's just with age, because 50% of people age 70 or more have this cerebral amyloid angiopathy. So this amyloid deposition in their blood vessels, and that can predispose you to bleeding in the brain. So in other words, someone over 70, just by being older, you have a good chance of being at a risk for having this brain bleeding. Other things that can be risk factors: cigarette smoking, alcohol consumption, and even like just chronic alcoholism, liver disease, and of course medicines, right? So this is what so if you're on aspirin, right? Or some people have to be on multiple medications to prevent heart disease, or if they've had a previous stroke, so you've had an ischemic stroke with a blockage of a blood vessel, and then they put you on a bunch of medicines to help prevent blood clots, well, that could predispose you to bleeding, right? And so something like warfarin or an anticoagulant that people might be on. So some people, you might know, Ali, have a heart rhythm problem and they have to be on an anticoagulant. So that's going to put you at risk. And then there's other things, some things called sympathomimetics. Do you know what those are, Ali?
I don't. Never heard that.
They're like stimulants, so stimulant drugs. So usually it's more like not like Ritalin, but like illicit drugs, so cocaine, amphetamines, but even something like ephedrine. So like remember people take pseudoephedrine, right? So abusing those can sometimes increase your risk of bleeding. So these are all things that need to be looked into, and this is probably what was looked into with Jamie Foxx. As we said, he says there was no cause; they couldn't find anything. In kids, we can see this bleeding into their brain. I've seen it I've seen it in newborn babies to like teenagers.
Oh, gosh.
I've seen it in every age group. Sometimes we don't find the cause. A lot of times they have what's called an arterial venous malformation. So basically, the way blood vessels should work is you should have arteries, which are bringing the blood to tissues, and then in between are tiny, tiny capillaries, and then those capillaries drain into big veins, and the veins go back to your heart. But sometimes you have a misconnection where the artery connects directly to the vein. And the arteries are big and thick-walled and are very durable, but veins are not, because they don't usually have a lot of high pressure between them. So if you're shunting blood from an artery into a vein, the vein's not used to that kind of pressure, and then it can predispose to rupture. So we see that not uncommonly in kids in terms of being a cause for hemorrhagic stroke.
You said it's less common than ischemic strokes, but how common are hemorrhagic strokes?
So out of all strokes, they contribute to about 10 to 20% of all strokes. And so the incidence overall is about 12 to 15 cases per 1 million people per year.
10 to 15 per 1 million. That's quite exceptional, right? That's quite low. That's why...
Well, yeah. I mean, 1, 2 per 100,000. Yeah, I mean, per year, though. I mean... I guess it's not that uncommon, yeah.
I guess not. Okay. And then how many people will die from one of these strokes? How many people will survive? Just to put Jamie Foxx's thing in perspective.
We could talk a bit more about prognosis in a few minutes, but in high-income countries, the case fatality rate, so you have this, is 25 to 30%. So that's pretty high. Now, keep in mind, like a lot of the risk factors are things that occur in older people, so there might be other reasons for them to pass away from this. In low to middle income countries, it's 30 to almost 50% which is
I
huge.
thought it would be less, to be honest. I thought it would be lower than high income countries because we eat such,
No,
fattier
this is a
food.
fatality rate, not the
Yeah,
incidence.
I know.
Yeah,
No, I
well,
thought the fatality would
I think
be.
the real reason is they don't have access to some of the treatments, especially surgery.
Sure. Okay, so on that note, why don't we talk about the symptoms? Jamie Foxx talks about having a splitting headache.
Right, exactly. And so what happens is the reason why you get that is you essentially get compression of brain tissues by the bleeding, and that results in increased pressure in your brain. So that's the headache. And usually the blood clot will then increase over 3 to 12 hours. And there's going to be even just the pressure of the blood clot on the adjacent brain will impair blood flow to those adjacent areas. So it's not just the area of the bleeding, it's the area around it too. So anyway, to answer your question, the symptoms are going to be headache, difficulty speaking, weakness, maybe on one side of your body or on your face, neck stiffness. And then basically, anybody who comes in like that, especially if they're decreased level of consciousness or who are developing, new neurologic abnormalities, you'd be pretty suspicious about this. Sometimes it's very hard to tell if someone's had a bleed or ischemic stroke. Sometimes you just can't tell based on it. Though a headache is less common with a ischemic stroke. So sometimes it's the headache and the weakness. You think, okay, maybe they had a bleed.
What is the delay between symptoms and actual stroke usually? Or is the symptoms mean you are having one right now in the month?
It's usually immediate. So the bleeding has occurred.
Okay.
Sometimes you could have what's called a sentinel bleed, which is an early bleed that it stops and then your symptoms may resolve, but that's pretty uncommon. So in general, you've had the bleed now because you're having the symptoms.
Oh, wow. Okay. How do you test for it then, especially if in many cases it's not easily differentiated between, because I imagine the two major strokes, you need a completely different way of treating them. It's important to know.
I would say in general, but because one is, you want to restore blood perfusion. The other one, you don't because you're bleeding, right? But in answer to your question, you want to do a scan. So CT scan, MRI, one of those will tell you the answer. And then from there, you can move on to deciding about treatment.
And what is the treatment?
So, there's a couple things that we do. Usually someone who's had this will go to the intensive care unit. They want to lower the blood pressure to prevent the blood clot from enlarging. You don't want to lower it too much so the brain has zero perfusion. So it's a bit of a balance, but you definitely need to lower the blood pressure. There are things you can do in the intensive care unit to decrease the pressure in your brain. So there's medicines you can give. They have a breathing tube and you can modulate some of that to help with that. If they're on an anticoagulant medicine, then you can give the medicine to reverse that, right? To get the bleeding under control. And then about 3 to 17% of patients will have a seizure in the first few weeks or have an abnormality on the EEG, which you might recall is the brainwave test that we do. So then you might treat them with anti-seizure medicines.
Okay. And is there surgery that can prevent it from happening again, or?
Yeah, so you can do surgery, and we see that in kids. We do that a lot, where they do what's called a craniotomy or decompressive craniectomy, where you remove part of the skull. But it's a bit, I would say, the evidence out there in adults basically says from one trial, there was no benefit in doing early surgery for patients with the hemorrhagic stroke compared to just no surgery and just manage them medically. So the question is, what are we doing? Like, the surgery sometimes makes the doctors feel better, but it may not actually help. They think that people who have small hemorrhages kind of at the surface of their brain and are maybe more milder, maybe those patients may benefit from early surgery. And certainly if you have bleeding in the back part of your brain, which is this area called the cerebellum, it's very tight back there. So bleeding there, they usually would recommend doing surgery. So it depends a bit about the patient and where the bleeding is, whether they would for sure recommend surgery or not.
I want to talk about how you prevent strokes. And is it just as simple as those things that make you high risk? You just sort of cut those out, the smoking, the drinking, the medications, or is there more to it?
Yeah, it's those things. So medicines you have to be careful about, right? So the perfect example is being on any blood thinner or antiplatelet agent like aspirin, right? You're on that for a reason, to prevent heart attack, to prevent sometimes a blood clot from your heart shooting to your brain and causing you a stroke. So saying you're going to stop those to prevent a hemorrhagic stroke may not make a lot of sense because you're just trading one thing for the other. But definitely what you said about all those things, diabetes for ischemic stroke, and then high blood pressure. So that's why like high blood pressure is one of those things where you don't notice that you have high blood pressure just walking around, right? People don't notice that, but it's slowly causing these problems in, say, your blood vessels that could eventually completely rupture, right?
Yeah.
The cerebral amyloid angiopathy, again, I'm not an adult neurologist. I don't think there's any approved treatments, but I have been to some conferences where I've heard people talking about drug therapy for this. So there might be some things now, but I'm not an expert in that at all. It does not occur in kids. So, maybe there's something that's either out now or coming down the pipeline, but it's not my thing. So it's really just overall health prevention that can help to prevent.
And prognosis, I'm always reluctant to say the word prognosis because of Prognosis Negative, the fictional movie that they watch on Seinfeld. But yeah, what is the prognosis?
So yeah, it's quite bad. We talked before about the mortality rate. I think the poor prognostic factors are like coming into the hospital in a coma, like comatose, like not awake. That's a poor prognostic factor. Having a very large bleed, being over 80 years old when it happens, having either uncontrolled diabetes or kidney disease, puts you at risk. But if you look at all people, even those people who survive at 6 months, only 20% of patients become independent for their activities.
Oh boy.
So then, now that you think about this, and Jamie Foxx, did have some good prognostic factors. So like Jamie Foxx, I guess, is 57 now. So he was 56 when it happened. So him being young is probably the best prognostic sign. And the fact that he is, like I said, I don't know, I'm not his doctor, but the fact that he seems to be completely independent for everything, it's amazing. So that's our episode for today. Let us know what you guys thought. I'm very curious if people end up watching this Jamie Foxx special, what they thought about it. Like I said, there is some good stuff, some good messaging. It's a positive story, obviously. It's, like I said, it's like nothing I've ever seen before. So let us know what you guys thought.
Oh, yeah. And remember, it's God who gives you strokes. No, God is not your doctor.
We'll talk about that in a second. So drbcomedian@gmail.com, Dr. B Comedian on Facebook, Twitter, Instagram. We are everywhere. Ali, what do you got going on for January, February?
January, February, we announced the Canada Reads long list and short list. You can go to CBC Books and see all that. If you are in the literature world, that would be very much of interest, I'm sure. And then March is when we have the 17th to the 20th, I believe, are the Canada Reads debates. And then I'm going on tour, Maple Ridge, BC, Edmonton, Alberta. I'll be at the Citadel Theatre for 4 days in early February. And yeah, touring around, enjoying life, having a good time. That's what I'm going to do. Nelson, BC. Stuff's happening.
This is all very exciting. So we're going to do the disclaimer now at the end of the episode. Should we say that God is not your doctor too?
Yeah, yes, I think we should.
I think I'll let people just, think about that for themselves. But I will mention that although I'm a doctor, I'm not your doctor. Medical issues we talk about for your interest and information only, and they're not medical advice. Please consult your medical professionals for actual medical advice. Thanks for listening.
Bye.